Welcome to the Great American Smokeout 2021, presented by Felicia, Cameron, and Jenna, first-year Parkland College respiratory therapy students. The Great American Smokeout is hosted by the American Cancer Society and is held on the third Thursday of every November. This year, it is held on November 18th. This day is special because it helps provide support to current smokers and supplies helpful tools and education to kick the habit for a day, but ultimately to encourage those to live a smoke-free tobacco, vaping, and marijuana life.
So who are we? Well, we are first-year respiratory therapy students here at Parkland. I'm Jenna. You just heard Felicia talk about the Great American Smokeout, and Cameron can be heard here soon. A respiratory therapist is a health professional trained to evaluate and treat people who have breathing problems or other lung disorders. A big part of our profession is to also educate. Hopefully with this PowerPoint, we can help educate our community on why we should never smoke.
Types of products that cause lung diseases include tobacco cigarettes, vaping devices, electronic cigarettes, smokeless tobacco, and marijuana. What you should know about Ecigs, vaping, marijuana, and smokeless tobacco. Inhaling harmful smoke can inflame your lungs and airway, causing them to swell and block oxygen. This can lead to acute respiratory distress syndrome and respiratory failure. Electronic cigarettes have become a popular alternative to smoking because it's supposedly less harmful than smoking tobacco cigarettes. Unfortunately, there isn't enough information on what chemicals are exactly in the products. There have been many outbreaks of lung injuries, including deaths, associated with vaping. The CDC has identified vitamin E acetate as a chemical of concern among people with e-cigarette or vaping use, associated lung injury, also known as EVALI. Vitamin E acetate is a thickening agent often used in THC vaping products, and it was found in all lung fluid samples of EVALI patients examined by the CDC. As of January 21, 2020, the CDC confirmed 60 deaths in patients with e-cigarette or vaping product use of associated lung injury. Marijuana smoking is associated with large airway inflammation, increased airway resistance, and lung hyperinflation. And those who smoke marijuana regularly report more symptoms of chronic bronchitis than those who do not smoke. Marijuana smoking leads to 4 times the deposition of tar compared to cigarette smoking. Smokeless tobacco products contain cancer-causing products, which increases the risk of mouth, esophagus, and pancreas cancer. Some forms of smokeless tobacco increases your heart rate and blood pressure. Long-term use of smokeless tobacco increases your risk of dying of heart disease and stroke. Listed are a few diseases and illnesses caused by smoking: COPD and other chronic lung diseases, chronic bronchitis, emphysema, asthma, cancer, heart disease, stroke, and diabetes.
Symptoms of smoking include cold hands and feet, frequent or recurring lung infections, high blood pressure and heart rate, loss of taste and smell, bad breath and yellowing of the teeth, premature aging of the skin, low oxygen levels in the blood, smoker's cough, which is a persistent cough with mucus production, a hoarse voice, and a lowered tolerance for exercise when you're easily fatigued. How to make a plan and quit. Write down when you smoke, why you smoke, and what you're doing when you smoke. These are your smoking triggers. You need to avoid these as often as possible going forward. Stop smoking in certain situations, such as during your work break or after dinner. Make a list of activities you can do instead of smoking, like taking a walk or chewing a piece of gum. You have to be ready to do something else when you want to smoke. Ask your doctor about using nicotine replacement therapy, gum or patches, or prescription medications. Some people find these helpful in curbing cravings. Join a smoking cessation support group or program. Call your local chapter of the American Lung Association to find groups near you. Tell your friends and family about your quit smoking plan and let them know how they can support you going forward. Look at all these positive effects that will happen in your body after you quit smoking. Within 20 minutes, We see results when the heart rate is returned to normal. 3 days after quitting, breathing becomes easy again. After a year, the chances of a heart attack are reduced. After 10 years, the chance of lung cancer is cut in half. Do your future self a favor and quit. Look at all these positive effects that will happen to your body after you quit. After just 20 minutes, your heart rate returns to normal. After 3 days of quitting, breathing becomes much easier. Between 3 and 9 months of quitting, your lung function increases by 10%. After a year, the risk of having a heart attack is reduced. After 10 years, the risk of getting lung cancer is cut in half. And after 15 years of quitting, the risk of a heart attack is the same as a non-smoker. So do yourself a favor now and quit.